Assalamu alaikum, hello and welcome to the Health Show here only on the Islam channel with me, Alistair Greener. And this is our very final episode of our third series. Now, as always, every week we're joined by a health expert within their specialised field. And together we discuss the prevention of health issues or concerns that we or our loved ones may face. Looking at how you can change your health and lifestyle for the better, the Health Show offers an alternative viewpoint from our health experts who attend the show, to help guide you in the right direction. Now, if you'd like any further information on any of our programmes or any of the topics that we discuss, then please do get in touch at healthshow@islamchannel.tv, and we'll give you that address again at the end of the show. Today, we're looking at oral cancer. To explain more, I'd like to welcome Mr. Ishaq Mahmood, who is a general practitioner dentist. Welcome to the show.
Hello, Alistair.
Great to see you.
Nice to see you again.
And it's a really interesting topic and one that's not often talked about, so I'm really interested in finding out more in a moment. Since graduating from dental school in 2012, Mr. Mahmood has worked at the Oral and Maxillofacial Department of Aintree Hospital. His interests lie in managing patients with gum and health issues, and as well as dental implants. But before we talk with Mr. Mahmood, we're going to take a look at a video clip. Now, while it's normal to feel nervous before a visit to the dentist, trainee dentists also suffer from nerves before treating their first patients. In a first for France, the Faculty of Dental Surgery in Strasbourg has acquired a very realistic training mannequin to prepare students for their real-life patients. Let's take a look.
When we train on our mannequins, we know how to do things. That's not the problem. The technical side is there. Everything that is relational with the patient is taught to us in theory, but we cannot do it in practice. Whereas here, it allows students to train on this patient before training on a real patient. It completely fills this gap today, but also because of a lack of equipment. Today the tools exist, so we must equip ourselves with this type of tool to better prepare them for the clinic.
We create complete scenarios according to the pedagogical objective, and there I can interact with a student through the microphone. I hear everything that is going on. I can talk and interact with the student to see how he or she is managing the relationship aspect of the patient as well.
It's interesting watching there the trainee dentist feeling nervous, because we never think about that as patients sat in the chair. But it is one of the things, isn't it? Nerves is one of the things that prevents people from getting good oral health because they're scared of going to the dentist.
Exactly, yes. So it's very common for us to come across in our daily practice many patients who will express that they're anxious or they've had a very bad experience being at the dentist. Now, unfortunately, I think a lot of this, Alistair, comes from sort of, perhaps we could say, unprofessional behaviour in the past, where dentistry wasn't very well regulated. We didn't have any guidelines from the Royal Colleges, and dentistry was still actually a very junior profession at that time. And at the time, really, we didn't really understand what was good for us and what wasn't good for us. So quite often the treatment that you'd expect at a dentist would be very invasive, a lot of extraction of teeth, and there wasn't really a care about prevention of oral diseases. So quite often patients would go to the dentist and expect to have a surgery done to them, and quite often at a very young age. And so unfortunately this instills dental anxiety, as we quite often term it, and you can never really get rid of that.
And one of the challenges, of course, is that many people will view the dentist not as the preventative measure that it actually should be treated as, but as something, when it's gone wrong, I will go. Yeah. But actually that's the wrong way round, isn't it?
Exactly, yeah. And this is something that we quite often mention to our patients, that perhaps, now with the younger children and with the younger patients, for example, we're very good. We always do a lot of prevention, and that's the focus of our work nowadays. However, yes, quite often we do see patients who are presented quite late with symptoms, and it does leave us with very little choice and treatment options. And quite often those treatment options can be painful and can be very invasive, only further adding to the anxiety that they already
Exactly.
have.
So if you had actually spent the time going through the preventative measures, actually you could probably help keep away a lot of that pain.
Exactly.
Let's talk about oral cancer specifically. What's the relationship between oral cancer and general dental health and hygiene?
Yes, so when we talk about oral cancer, we quite often talk about head and neck cancer in general because they're all very, very related, and the treatments are often interlinked and require the same subspecialties. So with general dentistry, for example, if a patient was to go to a dentist, not only do we look at the teeth and the gums, but quite often we're looking at the health of the oral tissues, so the tongue, the cheeks, the palate, and what we term as the oral mucosa. So we're looking out for things that we might think are suspicious or are not normal. And so quite often it's not simply about going to have your teeth checked and having a filling done, but quite often looking at the whole picture and seeing if the mouth is healthy as a whole unit.
And is that every dentist will be doing that? So when you go for your checkup, it's not just your teeth. Every dentist will be looking at everything else.
Exactly. So quite often your dentist may ask you about alcohol consumption, about cigarette use, and quite often they'll also encourage you to stop smoking and drinking alcohol because of the effects that it does have on the mouth. So again, we're looking at the whole picture really, because oral cancer, unfortunately, is a very common cancer. It has increased 31% since the early 1990s, and now is the 8th most common cancer in the UK.
What do you think's caused that sudden increase?
I think perhaps there's been an increase in use of cigarettes, perhaps, and also a modern phenomena of use of shisha. These two substances are very, very toxic. Unfortunately, they can have a very huge effect on the mouth. Of course, smoking, the first place that it hits is the mouth. It'll be the lips, the tongue, and the palate. And so that will be the first place which will be affected by the cigarette fumes and also of the shisha as well.
So when a dentist looks in your mouth, what are the sort of telltale signs that a dentist will notice? And for that matter, will you as the patient, would you necessarily be aware of that problem? Because obviously we don't often spend a lot of time looking right inside our mouth cavity.
Now, it's quite sad, unfortunately, because oral cancer it only becomes noticeable and painful when it's quite late and when it's perhaps spread to further parts of the body. So you're right in saying that oral cancer can sometimes be undetected by a patient, again, emphasizing why early detection is very important. So some of the things that we might be looking out for are ulcers which don't heal after 10 days, or things such as red and white patches in the mouth, things which, for example, an area of the mouth which is sore and bleeds very easily. These are sort of more of the common signs. But unfortunately, there are certain signs which you can't see in the mouth. They may be further back, and they can present such as changes in your voice, changes in the function, and pain on swallowing. These are sort of signs.
But way before that stage, a dentist could see some form of variation that doesn't look normal and therefore recommend that you get it checked out.
Exactly. So if we have a suspicion of anything which looks a little bit suspicious, very often we will refer that to the maxillofacial department as an urgent referral, because we are aware that perhaps it could turn into something sinister. So early detection is vital.
One of the things we introduced you, well, not one of the things, we introduced you as a GP dentist, a general practitioner dentist. What's the difference between that and a regular dentist that we might go and see?
So dentistry's changed quite a lot in the past decade, I'd say, and the government's been very keen to change the way that dentists work. So dentists used to be very sort of single-handed, and by that we mean it would be just one dentist working in the practice, just seeing routine patients for very simple care. However, now dentists have developed what we call special interests, and these dentists, for example, will work still in primary care, but are able to offer patients a greater variety of more specialist services. So again, taking it out of the realm of secondary care in the hospitals, providing things such as dental implants, providing gum treatment and restorative bridge work, for example. These things are now being done more common in primary care because of the introduction of more general practitioners with these specialist interests. And again, that benefits not just the dentists, but also the patients, because it means that patients are able to access these services in the community, as opposed to maybe having to have that done privately or having to access that service at the hospital level, which obviously adds time and expense.
So therefore, the principle is all about getting people more frontline facing. So therefore, people will hopefully, again, take up a preventative measure. Coming back to oral cancer, is there like an age group that's particularly susceptible to it?
So oral cancer tends to present in the older age group. So the average age will be around 70 years old. Men and women are equally more or less affected by oral cancer. However, there are small differences in between the two, depending on the site of the cancer. So quite often it does present at an older age. Unfortunately, this does cause lots of problems because patients at that age are often not as healthy and they have a lot of comorbidities. So the cancer tends to take grip a lot quicker and a lot faster, and it tends to be much more severe.
And is there any difference in ethnicity in terms of your likelihood of contracting it?
So interestingly, there tends to be not more based on the genetic predisposition, however, more on cultural habits. So for example, if I was to tell you, Alistair, that oral cancer is actually the most common cancer in India, and it affects around 64% of the cancers are oral cancers, as opposed to maybe just about 3% in the UK. And the reason for that massive disproportionate effect is because of the use of pan, supari, betel nuts. So these are things which people often chew in the mouth, and they are very, very highly toxic and contain carcinogens. And constant chewing of these substances has an effect on the mouth. So chewing such substances is very common in the subcontinent, and that's why we find that oral cancer is the leading cancer in the subcontinent.
That is amazing. And what about younger people? Is there other things that people are doing when they're younger that could present itself later on in life? So in other words, you're actually doing the damage now, but it won't actually manifest itself in a disease until much later.
Yes, unfortunately, there are a few habits which are sort of more common amongst the youngsters. So smoking is quite common throughout the age group. There doesn't tend to be much of a difference. Shisha usage tends to happen more in the younger age groups, and shisha is a carcinogen and can have effect not just on the lungs, but again, oral cancer is one of the problems that it can cause. There are also other certain activities, certain sexual activities, which are more common in certain age groups, which also can have an effect on the mouth and cause oral cancer as well.
And so again, it's all about, looking after yourself, getting yourself checked out regularly. And the trouble is, I suppose, again, with so many of these diseases, that it's over a long period of time that something happens.
It is.
If you changed your lifestyle, let's say, for example, you quit smoking shisha or something like that, how quickly is the mouth able to restore itself back to normality?
Almost instantly, to be honest. Actually, we say, for example, with gum disease is directly linked to smoking and shisha usage. The moment you stop, the health of the mouth improves drastically. So you can reverse a lot of the damage that has been done. As for cancer, unfortunately, you will still have an increased risk. However, if you continue to smoke, it will increase your risk multiple folds with each cigarette. However, the moment you stop, you do start to decrease that risk. And there is evidence to suggest that you could become at the level of a normal person who has never smoked. So the sooner you stop, the better.
And it's incredible, certainly when we've talked to experts about lung disease and things, it's amazing how certain parts of the body can repair themselves quite easily despite the trauma that they've been through. In terms of, we always hear about teeth, and especially when we have children, because there'll be parents watching, thinking, there's my child eating more crisps or eating things which aren't particularly good. And we know they're not particularly good for children in terms of tooth decay and things like that. But what about the effect on oral cancer? Can they be doing themselves damage in that respect too at a young age?
Yeah, there's a lot of evidence, and Cancer Research UK recently did a campaign in the UK talking about the link between obesity and cancer. So obesity has an effect on the body in general and does predispose a person to cancer, and oral cancer will be one of them as well.
And what about general oral health? So in other words, if you don't look after your teeth, if you don't go to the dentist regularly, yes, we understand that obviously a dentist will pick out something and see something, but actually just general neglect of your teeth and gums, will that increase your chances of getting oral cancers?
There is some evidence to suggest that poor oral hygiene, poor oral health can predispose a person to oral cancer. There is still a lot of research being done in that field to try and find a certain link, but there is increasingly a large body of evidence to suggest that. And the reason mainly being because in the mouth there's a lot of pathogens, and obviously if it's not being removed carefully and with great detail, they can then go on to cause problems, not just on the teeth, but on the oral soft tissues as well.
The first big question people always ask, and anybody who goes to the dentist regularly will know this because it's always asked, is the electric toothbrush versus a regular toothbrush.
So interestingly, there's a large amount of evidence to suggest that use of an electric toothbrush increases the amount of plaque which is removed from the teeth, which then has an effect on the cleanliness of the mouth and also does lead to a correlation, which is a decrease in dental decay and a decrease in gum disease and its severity. So a lot of evidence has been performed by the clinical bodies, and there is now a greater push for patients to start using the electric toothbrush because we know that it does have a benefit to the mouth.
And there's different types of electric toothbrush as well. What's your opinion on them? You've got this the sonic ones, you've got this rotating ones. Is there any difference in the research that you've seen?
So the research tends to point to the fact that the oscillating brushes, which tend to be the ones with a very small round head which rotates in a circle, they tend to be better at removing and disrupting plaque, which is bacteria on your teeth, as opposed to the vibrating ones, which tend to just only remove superficial amounts of bacteria and not really target deeper down, which is where you really want to be targeting with your toothbrush.
Another area of oral health is flossing and using rinses and things like that. Flossing, first of all, and something that I probably only came to see relatively recently, certainly within the last maybe 5-10 years, are these little teepee sort of dental brushes, I think they're called.
That's right.
Tell us a little bit more about them and who should be using them and how often.
So those little brushes, the TP brushes or the interdental brushes as we refer them to as, the idea behind them is that you remove any food debris and plaque which is in between the teeth. Now, remembering and bearing in mind that dental decay will start off in between the teeth. So if you're able to remove the plaque and the bacteria which is there, you do then reduce the likelihood of that area developing decay. And the second benefit to that as well is that it does impact on the gums. So if a person doesn't brush their teeth very well and they're very lazy about removing the bacteria in their mouth, eventually what will happen is that those pathogens will start to cause inflammation in the gums, and that inflammation will then start to destroy the bone which is holding your tooth in. That is called periodontitis and gum disease. So starting off by preventing that, the best way is to brush very thoroughly for 2 minutes a day, and then also to clean in between the teeth either with floss or with an interdental brush or mouthwash.
Another big question that people always want to know is, do I brush my teeth before or after a meal?
To be honest, quite often it's down to personal preference. There isn't really any evidence to suggest that it should be done either before or after a meal. Some people prefer to do that before so that their mouth feels fresh for the day and for when they're going out. And some people prefer to do it afterwards because then everything's clean and then they can go on their way. There isn't a great deal of evidence. It is all down to personal preference.
And can you overly brush your teeth? Can you overdo it?
It is possible. So if one was to overbrush their teeth or use a very hard bristled brush, quite often what will happen is you will start to have an effect on the gums and cause gum recession, and that can be quite a painful process and lead to tooth sensitivity. And furthermore, overzealous brushing can start to wear down the enamel of your teeth and start to cause cavities.
A big issue that people are always concerned about is blood, which might come from general brushing, it might come from flossing. What's the general rule about that? Should that be a key indicator of something going wrong, or is that normal?
So we always sort of accept that there may be a small amount of bleeding on brushing. So if it's a very small amount and it doesn't happen very regularly, it could be that perhaps an area was traumatized, or perhaps you'd be brushing a little bit too hard once or twice. However, if it's a very common thing and that it's happening every time you're brushing and the amounts are a lot larger, it could indicate gum disease, which will need treatment from a dentist very, very quickly.
And what is the treatment for that?
So the treatment for gum disease, in essence, sounds very simple, and it's for a debridement and cleansing of all of the teeth and the gums, quite often done with local anaesthetic in the mouth to make it more comfortable for the patient. And then the real test really is down to the patient, is how well can they maintain that at home. So it's all about the patient's cleanliness at home, regularly cleaning their teeth and using interdental brushes, because despite our best efforts as a dentist, if the mouth is not maintained and cared for at home in between visits, nothing will improve, unfortunately.
And what about mouthwashes? There seems to be, quite a lot of discussion about mouthwashes, whether they're really necessary or not.
There is, unfortunately, still very limited evidence to suggest that mouthwashes are beneficial. I tend to recommend mouthwashes to patients who have limited dexterity. So if they aren't able to clean their teeth thoroughly, and that could be for a number of reasons, perhaps they've just had recent surgery to the mouth, or perhaps they have Parkinson's, where the dexterity of their hands isn't as good as it used to be. So mouthwash just helps them to improve in cleaning certain areas. But mouthwash isn't a replacement for toothbrushing or using interdental brushes, and therefore it's only as an adjunct to sort of provide freshness to the breath more than anything.
It's quite funny, isn't it? Because whenever we talk to somebody who's an expert in a certain field, you immediately are drawn to that particular issue for themselves. So I'm drawn, for example, to your teeth, which I have to say are excellent, which you would expect them to be, right? So how do you treat each other? We will talk, we'll come back to oral cancer in a moment, but in terms of looking after each other's teeth within the practice, you know, I suppose you're under a real amount of scrutiny to make sure you've been looking after them.
Yeah, so one of the first things that a patient might notice when they come to see the dentist is the dentists themselves and their appearance. And I have had many patients remark on my teeth, and you know, always wishing that they could perhaps have them as well. So as dentists, we do take a great pride in our oral care, because we're aware of the fact that if we don't, it doesn't look good for the patients, but also it does have a lot of effects. So we want to stay away, equally so than as our patients, to dental decay and gum disease. So we, as humans really, will go for regular dental checkups, and we're perhaps a little bit more overzealous, and we will be very quick to point out if there's any problems and regularly get our teeth checked.
And very quickly, just before we go to a break, and we'll come back to more of this, and maybe on a slightly more serious subject later on after the break, but advice to people who maybe have been a little lax about going to the dentist. Just give them a quick reason why it's so important to go regularly.
So it's very understandable that patients may have had very bad experiences and they have a lot of dental anxiety. However, it's important to note that now dentists are trained in how to deal with dentally anxious patients. The techniques that we use now are much less invasive, and quite often there's options and there's choices. So it's not all about the dentist says this and therefore I have to. The patient is very, very involved in the process, and quite often we can treat a lot of the problems with a lot of with pain-free mechanisms and make it a lot more comfortable for the patient as well.
And you know what's really interesting is the fact that if you really do that, you're going to save yourself a lot of anguish later on if you do go and get it checked out properly.
Exactly, yes.
Yeah. Well, it's absolutely brilliant. Thank you so much indeed. We have got lots more to talk about later on, but for the moment, thank you very much. Now, we must stress that should you suffer from any medical problems whatsoever or have any health concerns, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. We've got lots more to talk about, but it's now time for a break, so don't go away. Welcome back to the Health Show, where our topic today is oral cancer. Sweden has the 5th highest life expectancy in Europe, and cancer survival rates are amongst the highest on the continent. But the Swedes are frustrated that their tax-funded healthcare, one of the main pillars of their cherished welfare state, is taking too long to access due to the lack of nurses and available doctors in some regions.
Eftersom vi har en prioriteringsordning där vi I första hand...
We prioritize children and those in need of emergency care first. Therefore, a patient who needs a checkup may have to wait a while, and that could take up to 4 or 5 years.
...handlar den patienten. Bristen på sjuksköterskor idag är den tydligaste begränsande faktorn.
A lack of nurses is the most clear limiting factor to shorten long waiting lines. We also see a blatant lack of available doctors in some regions across Sweden.
Ska man titta generellt I Sverige så finns det ju regioner som har en påtaglig brist också på läkare.
Adekvat. Och sen blir det hud. Vi kan ta hand om dem som är...
We can take care of those who are gravely sick, but we appear as if we're not fully available, as politics would wish and imagine how it should be.
Förändring.
Att Sverige har en
Sweden has a fast-growing and aging population, and we have educated too few people who can work in the healthcare sector to meet the needs.
För att möta de behoven.
It is always interesting, isn't it, watching other countries and making a comparison, because we have our cherished NHS here in the UK, which does do an amazing job. Obviously, like many things, it's under a tremendous amount of stress in terms of resources, which will always be stretched. But the NHS, in terms of dental health, is still really, really big, isn't it? They do a huge amount.
It is. So the NHS provides any treatment which maintains the oral function. So it's very specific wording, but it means that patients shouldn't be walking around in pain, and they should be able to be comfortable and happy with their teeth and their oral health in general. So that's what dentists generally provide. In the NHS in the UK, dentists are paid very differently as they used to be. And it's brought a lot of changes, and unfortunately we are starting to see a lot of discontent among certain healthcare professionals. But the majority of dentists in the UK working under the NHS are able to provide a fantastic service and a very, very broad range of dental treatment as well.
And of course, there are many members of the community in the UK who actually get free dentistry still, don't they?
They do, yes. So certain patients who are on certain benefits are able to claim reduced or free dental treatment, and this is a fantastic thing. Quite often, unfortunately, these are the people who need a dental treatment the most. And so quite a lot of patients will come to us, and we're more than happy to provide an equally exceptional service to patients who are paying or non-paying at all times.
And coming to the differences between the NHS sector and the private sector, there's also an additional element to the private sector of health insurance and dental insurance. What's your take on that?
So there has been an increase in the number of companies offering dental insurance. Quite often they work on a pay-by-month basis, where you'll pay a fixed amount per month, and that entitles you to a certain level of care, a certain number of dental checkups and hygienist visits. And it does provide a very affordable way of dental treatment, because quite often private dental care can be very expensive. The difference really between NHS and private dental care mainly is that the NHS is focusing more on what's needed to restore oral function. So can this person eat, and can they chew and speak perfectly normally? Whereas private dental care focuses on those things, but also in addition to that, the aesthetics of teeth. So trying to straighten teeth, for example, whitening teeth, making them look better, improving your smile. And although this is very important as well, it's not affordable for the NHS to provide these services, so they're all private.
So it's a little bit, determining between got to have and nice to have.
Exactly, yeah.
And there's quite a lot of things. So certainly when you get into the cosmetic side of dentistry, that obviously is only available from a private dentist.
Right.
And things like, for example, implants, crowns and things like that. How much of that can the NHS cover? Any of that, or you then having to go down to sort of maybe having dentures and things?
So the NHS does provide most of those treatments. So they will provide certain bridge work, crowns and dentures as well. There are different types of dentures and crowns which are provided on a private basis, which look a little bit better and provide more strength. However, generally the NHS does provide those. As for implants, they are very, very limited under the NHS, and they are only provided to patients who really meet the criteria. And these are generally patients who have had severe oral cancer, and implants are the only way which we can restore their oral function.
And again, just to define an implant is basically where you're going into the jaw, is that right?
It is. So quite often we describe them as a little bit like a screw, which is screwed into the bone in the jaw, and on top of that will be a tooth or a crown, which is held in securely.
In terms of dental health, we've talked about the options between NHS and private and insurance. There are some people who are going, to other countries for dental treatment. What's your take on that?
We do take quite a dim view on patients travelling abroad, and the reason for this mainly is that we aren't able to provide a continuity of care. So if something was to go wrong with that treatment which is being provided abroad, it wouldn't be easy for us to know what's being done for that patient. We don't really know the ins and outs of that treatment that they've had, and therefore we're very limited in what we can offer and provide for that patient. And so quite often they will have to go back to that country to go and get that rectified, which adds further time and expense for that patient.
And it's a little bit like we hear quite often from cosmetic surgery in different parts of the world, that actually it winds up being the NHS that has to then repair the bad job that's been done by someone else.
It does, and the NHS is quite strict on that, and they're not very keen to be picking up the mess that's been made perhaps abroad. And so again, really, we would always encourage patients to consider their options very carefully and only consider that treatment option if they were very confident in that person who was going to provide that treatment as well.
Coming back to oral cancer and developing good habits, because we talk a lot on the show about good habits in terms of what we do to looking after our teeth, and we'll go into the regime again of what we should be doing on a daily basis and a monthly basis and an annual basis. What about the foods that we eat and exercise? We've talked about drinking and smoking. What about foods and what about exercise and things? Does that make any difference to our oral health?
So there's a lot of evidence to suggest that certain foods can have a direct link onto oral cancer. So we mentioned before the use of palm supari and betel nuts, which is very common in India and the subcontinent. These certain foods can cause oral cancer, and there's a direct correlation between the use of these and oral cancer. As for other evidence, there is new emerging evidence to suggest that foods which cause a lot of trauma or extremes in heat and for example, hot and cold, these can have effects on the oral tissues or the oral mucosa, and these can then predispose a person to oral cancer. Although not carcinogens in themselves, which is something which directly causes cancer, they can make it easier for cancer to develop in a person's mouth.
And it's quite interesting when you talk about those sort of different things, because obviously there's a huge, wide variety of different things, from people chewing ice cubes while they do it, but they do, and eating sharp foods and things like that. So all of those things really, as a general habit, is probably something to avoid.
Yeah, so we're always very keen to encourage patients not to. So one of the logic behind that, for example, would be that the patient, if they've eaten a lot of sharp foods, it will traumatize the gums, it will traumatize the oral mucosa. And in the person, for example, who smokes, that little bit of trauma, in addition to smoking, can have a combined effect and unfortunately lead to cancer. So it's important to make sure that we look after our mouths and be very careful not to have such extremes in foods, and try to look after our mouths and keep an eye out for anything that's suspicious.
You said earlier that this is a cancer which is actually becoming more and more common. What about the treatments? Have we got to a stage where the treatments are a little bit less invasive? Or how do you, let's say, for example, you've spotted someone has something in the mouth when they've come in for a checkup, and you've sent them to be checked out. What's the process from then on in terms of then treatment and then aftercare? So
once a patient's been referred, usually on an urgent care pathway, the patient will be assessed, and early detection is key. So we stage cancers stage 1 to 4, with stage 1 being the least severe and stage 4 being the worst. So cancer which is detected at a stage 1 does have a very, very good chance of survival at 3 years of around 80%. The treatment for it will tend to be less invasive. It can often be done with minimal surgery in addition to perhaps radiotherapy and chemotherapy. Late stage cancers such as stage 3 and 4, the only treatment options for those tend to be radical surgery, and that does often involve a huge amounts of facial reconstruction, which does take a lot of time to do, but also has a huge impact on the patient. And quite often these patients will require a lot of radiotherapy, perhaps chemotherapy, and then lifelong support to regain their oral function and confidence as well. And, is it one of those cancers where, yes, the worst can happen, people do die from it? It is a fatal condition. So oral cancer, as mentioned before, does have around an 80% chance of survival if caught early. If caught late, it drops significantly down to 50% at 3 years. So really, early detection is key in oral cancer. And looking again at those particular cancers, you said it's predominantly people who are older, and people who maybe it's a culmination of things that they've done in their life. Does that make treatment harder because they're older? Does it make much difference? It does, because unfortunately these patients, their bodies aren't as fit, and sometimes they're not able to perform surgery on these patients because we know that they won't be able to recover afterwards, and so it doesn't leave us with much option. And sometimes these patients can become palliative and unfortunately do pass away very quickly. And so we do find that the older generation patients which oral cancer tends to present in does lead to a lot of extra problems. So even if a patient does have the surgery, they aren't able to bounce back as perhaps a younger patient would have been able to with the same condition.
And we talked earlier on about the different ethnic groups. We talked about, different ages and things. Are there any other variables that can affect people's chances of getting this cancer?
Apart from when we talk about what the chances of getting the oral cancer, we normally refer to the risk factors. So the risk factors will tend to be lifestyle habits and cultural habits. So chewing certain foods, as we mentioned before, smoking and alcohol, and use of shisha. So these are the things which tend to predispose a person to oral cancer. There is some evidence to suggest that patients are more predisposed to cancers in certain cultural groups and ethnicities. However, there isn't enough evidence to suggest or pinpoint that that's an actual correlation at the moment.
Whether it's actually an ethnicity or, as you said, a cultural thing there, which is, obviously quite interesting to see that difference. And what about the genetics? I mean, if it's something that maybe a parent or an uncle or an aunt has had, is there any increased likelihood of you developing it, or is it one of those things that's pretty much down to lifestyle?
It tends to be more down to lifestyle. So if you compare oral cancer to a different one, for example, bowel cancer tends to have more of a family predisposition. So this is why we often have screening programs, because we know that if one person's had it or certain ethnicities are more predisposed, we could sort of be more confident to say that if we target these patients, we know that we may pick up a few more. Unfortunately, oral cancer doesn't quite have the same sort of screening process, because it does affect people, and it can affect patients who are a lot younger, patients who are older, and it affects all four corners of the globe to different degrees as well.
And one of the things that it does seem to be this more positive view on being able to maintain people's teeth and keep them. And that actually, we've seen some programs where you've seen some people's mouths which have been in a pretty shocking state, but actually it's remarkable what you as dentists can do to restore the physical health, but also the confidence level that somebody would have.
It does, yes, because quite often we use our mouths every day to speak, to eat, and so if there's any discomfort, we tend to see it, and also we feel it very, very severely. And so now we've seen technologies where we're able to do, some people would like to call them full smile makeovers, or the new term for it is digital dentistry. So use of these new technologies has allowed us to develop new techniques and new treatment options for patients. And again, this is all fantastic news for patients, because it means that perhaps maybe a few years ago there was no hope and it seemed like the end of the tunnel, but now we're able to offer a real chance of hope for patients in gaining that confidence back in their smile.
Another area of dentistry that seems to have expanded dramatically over the last few years is orthodontics. And the British were often, almost mocked by our friends in America and other places for not having terribly good teeth.
Right, yeah.
That's very much different today. Give us an idea of the importance of orthodontics, why straightening children's teeth, why correcting them at a young age, why it's important, and what benefit that is for later on in life.
Yeah, so straightening teeth isn't always just an aesthetic or a cosmetic concern. Quite often it's a functional problem too. So that child or that patient, if it's not treated, it can lead to more severe problems later on, where they're not able to function with their teeth. And also there's a lot of social issues too. Quite often children being bullied for not having straight teeth. So by treating their teeth very, very early on, it's a lot easier for us to do. It's less expensive and it requires less invasive treatment. If left into adulthood, it does quite often require longer treatments, much more expensive, and also it does have a greater impact on the patient at that time. So we're very, very keen to detect this early on. And again, regular dental checkups with a dentist at that age will allow us to make the appropriate referral at the right age.
So let's look at your career. What got you into dentistry in the first place?
So personally for me, I think it's always been about being creative. So dentistry is a very creative, subject. At the same time, it's a healthcare profession. So it allows me to balance two things which I enjoy very much, which is to try and help people to gain confidence in themselves and to improve their overall well-being, and also being able to do something with my hands. So being able to do things which are challenging. So no 2 days will be the same in a dental practice. You may often have patients who are very anxious, but being able to see them in their journey going from where they begin to where they end is a very, very pleasing thing to do on a daily basis.
And has the training changed much over the years? You obviously, when you first got into dentistry, you were talking to dentists who'd been around a long time, and I'm sure you're doing a bit of comparison of the training methods. How much has that changed?
Now the teaching that we have in the university is very much student-centred. So each student is treated as an individual, and so the training that's provided to them is based on what they want to achieve. Whereas perhaps in the past it was very much a treadmill process where everyone had to learn the same thing, do the same thing, and then you ended up apparently as the same. But we're much more aware that nowadays people are people and humans will always have differences and variations. And so now we're using new technologies. We will use what we call phantom head on which we can practice our skills. And now there's a lot of push for improving our communication skills. How do we deal with anxious patients? Because we understand that a lot of bad has happened in the past, and we're very keen to change that for the future generations to come.
Let's come back to the whole issue of general health. Give us a regime that really, as a bare minimum, this is what we should be doing every day to look after our oral health.
So it's important to remember that we always encourage patients to see a dentist regularly. As for children,
and what's the definition of regular as far as you're concerned?
It does vary, but usually a 6-month recall in between appointments is the average. Some patients will require more intense close-up, so perhaps 3 monthly, depending on their needs, but usually going every 6 months to have a regular check. So as we mentioned, it's not just to check the teeth and the gums, but also to check out for any suspicious lesions which could predispose you to oral cancer. And also it allows us as the dentist to make sure that the patient is doing everything correct to prevent problems later on. So usually every 6 months we'd advise the patient to come in and check their teeth and their oral health, and on a daily basis at home, making sure that meticulously cleaning the teeth for a good 2 minutes in front of the bathroom mirror, trying to floss and use incidental cleaning aids such as TP brushes, and then again perhaps more on a yearly basis as well, revisiting the dentist and making sure that your plans and your ambitions are reviewed. So if there's anything which you've perhaps been told to have done, a certain treatment, and you've been delaying it, it's important to make sure that you sometimes sit and think, perhaps I should get that treatment done before it becomes a bigger problem later on.
Periodically, when I've been for checkups, they've given me x-rays. How often should they be done? Because, of course, that's looking inside the, underneath the teeth, so you can see different potential problems. Exactly. But how often should that be done, do you think?
So we often take x-rays depending on the patient's risk. So if a patient has a very poor diet, we're worried that they may be developing cavities very quickly or gum problems, we may wish to repeat those x-rays as often as 6 months. But for the general population who pose perhaps a low risk and we're quite happy with them and they're maintaining their oral health while at home, between 1.5 years to 2 years, periodically taking x-rays just allows us to make sure that if there is anything developing, we can pick it up early and treat it very, very quickly as well.
And the big thing, of course, which is the whole subject of this show, is the fact that a dentist isn't just looking at your teeth, they're looking at so much more.
We are indeed, and we're looking to make sure that the patient is well equipped with the tools and the knowledge to look after their teeth and their oral health at home, and so that if they do notice anything, that they're able to come back to us and we're able to help them to the best of our ability.
Coming back to, people who are nervous about going to the dentist, what would you say to people who are saying, I know what you're saying. You're saying it's much better and we've practiced our communication skills, but I'm still nervous. I still don't really want to go. Are there alternatives? Can you have a general anaesthetic? Can you avoid injections? Are there things that you can do to allay people's fears when they are that traumatised about the thought of going to a dentist?
Yeah. I think the key thing here, Alistair, will be that the patient needs to acclimatise to a dental environment. So the best way to treat this problem, and quite often we do this, is we'll invite a patient and they may just sit in the waiting room and they can sit there for half an hour. And then the next time that they come, they can maybe sit in the chair. And then the next time after that, they can start to have things done to them. And so this sort of acclimatisation breaks down the barriers and the fears that they have. There are treatment options available. So if a person, for example, does need some treatment and they feel that they aren't able to cope, we can offer sedation where they're able to feel a lot more relaxed. And in perhaps maybe a bit more extreme cases, there is the option of having a general anaesthetic where you are put off to sleep to have that done. But again, those will be reserved for patients who have specific needs for that.
And just to finish, really, for, again, general advice for people, if you could sum up how to make sure that you keep, your teeth, your gums and your mouth healthy, food-wise, and just generally, what would be your final tip?
So I think a couple of things would be, one is to make sure that your diet is well controlled, so trying to reduce the amount and the number of times that you're having sugary foods. Try to reduce that down to just once or twice a day as a maximum. ensure that you're brushing very, very carefully using a good fluoridated toothpaste and brushing for a good 2 minutes per day. And then also just using interdental cleaning aids to clean and remove food debris in between the teeth. And then just have a look out in the mouth in front of the bathroom mirror for anything that perhaps does look a little bit suspicious, and get it checked out by a dentist.
And most importantly, if you do all of that, the chances are when you go to the dentist, it will not be a traumatic occasion.
Exactly, yes.
It'll actually be just a nice, yeah, looking good. You can leave again.
Hopefully.
Thanks. Ishaq, thank you so much indeed for coming into the show. It's been great to have you again. That's all we have time for today, but again, I'd like to thank our guest, Mr. Ishaq Mahmood, a general practitioner dentist, for coming onto the show today and for discussing the importance of oral health and some basic habits to maintain our teeth in a really healthy state. And once again, we must stress that should you suffer from any medical problems or health concerns, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. If you'd like to find out more about this or any of the subjects that we've discussed on the show, then please do email us at healthshow@islamchannel.tv. We would love to hear from you, and especially if you have ideas for our next season, because yes, this is the very last episode of our third season of The Health Show here on the Islam Channel. So we'd like to say a big thank you to all of our guests who've attended the show. And most importantly, thank you for joining us every week. We really appreciate it. And we look forward to seeing you again for season 4 very soon. Thank you again. Assalamu alaikum.